All right. We are trying this again. I think we got it this time. I'm going to invite Patshawna to come back. All right. We did it. Yay. Okay.
Hi.
Yes, I can hear you. Yay. Okay. Whew. The devil
Is it
was
echoing?
busy. Okay. Yeah. Apparently,
I'm
that's like a
trying.
common thing, though, with the
Is it?
earphones and all that. Yeah.
They should have like a warning.
Yeah, that would be smart, right? If they're just like, you're about to bring a friend, make sure they have headphones. That would be smart.
Right.
So, but anywho, we did it. So yay. Hopefully, the people will start coming back in. But we can get started. So first of all, everybody, I'm so happy to have this wonderful guest. This is Patshawna. Is it Nickeo?
Nickeo.
Nickeo. She is an MSW, LSW, CCTP, DBT-C, and currently getting your doctorate for clinical
My
sexology,
PhD.
Right,
Yep.
PhD.
Yep.
Yes. So, what does all that mean? Tell everybody what do you do and what does all of that mean?
So my CCTP is basically it's certified clinical trauma professional. It's essentially just saying that I did a little bit of extra education on how to deal with people who've been through traumatic situations. Nothing super fancy, but it's really just I just did a little bit more education on it. My MSW, my LSW is of course my degree background. DBT C is dialectical behavioral therapy. It's a type of therapy, and the C is that I specialized in learning how to do it with children. So really just anybody under 18. I've mostly done it with my residential patients, and their ages range from the youngest right now is 13, the oldest is 19.
Okay.
So I've saw a lot of great good with that one, with using it with them.
Can you do like a layman's term? So for those who might not know what DBT is and that type of intervention, I talk a lot about CBT. That's more of my preferred intervention of choice. But what is DBT and like what does that look like?
It's very similar to CBT. Honestly, it's not much different in my experience. It's just a lot more question and reflection, in my opinion. A lot less more about the cognitive, like the brain. It's more so just like reflection of oneself.
Cool. And talk a little bit about the PhD program that you're in and what that entails.
Yeah, so I'm getting my doctorate in clinical sexology, so to be a sex therapist. Surprisingly enough, my concentration is going to be in kink. So I'm going to be learning a lot about BDSM, the lifestyle, different like safe ways of how to do BDSM, and it's kind of to help people navigate their own lives through those channels in the safest way possible.
Awesome. We already said we're gonna have to like talk about that. That'll be a whole different, therapy Thursdays, talking about sex and healthy sex, because I think people don't talk about it enough.
Yes.
And it's a very taboo thing, and it's like just don't have it, and let's not talk about the,
Yeah, just don't have it.
So I'm really excited
or
for
pull
us
out,
to
like
talk
no.
some more about that as well. So one of the reasons why this topic came up was I saw you make a status the other day about vicarious trauma, and I was like, yes. So what caused you to make that status? What was going through your head in that moment?
Yeah, so with my new job, I'm working in residential, specifically with teenage girls who've been through very traumatic events in their life. Some their whole lives, some that have been sex trafficked, abused, sexually abused, mentally, physically abused. And I found that I was tending to stay a lot later at work because they needed me,
Mm-hmm.
right? I needed to be there for them. I needed to show that I can be that one consistent person in their life. And because I've taken the training and I know myself well enough, I started feeling myself become almost triggered.
Mm-hmm.
I have my own past history with trauma. So it was like certain things that they were saying, or certain ways that were going on, like group sessions, like my process group or my DBT group, that I would almost feel what they're feeling.
Yeah.
And I'm like, oh no,
Yeah.
I know what's happening. I need to back it up. I need to start setting a lot more boundaries and hard limits with them, to the point where I had to say, like, okay, by this time I am leaving the building. I don't care what's going on. Like, I'm zipping out. Like, I gotta
Yeah.
go, because I have to take time to take care of myself and to kind of unwind from the day. So I need at least, I would say, a good 4 or so hours just to get myself back.
Mm.
I'm on baseline,
Yeah.
because my job is so, it's a lot.
Yeah.
It's a lot to deal with for 8 hours. You're talking about trauma and straight trauma.
Right. That's so good. And we'll get a little bit more to the personal experiences later, but yeah, absolutely. And I think any person that's in the helping profession, but especially like when you're constantly in constant contact with people who, you know, where it's just trauma after trauma after trauma, that's something that I realized that it was like a new transition, because I went from working at various like agencies and health clinics to just doing therapy every day, you know, so it's like 9 hours sometimes back to back to back of like, I'm listening to an hour of you, now an hour of you, now an hour of you. And I think especially as social workers, we already have that innate like empath thing. So it's like, I already feel so much, and now I'm just feeling everything. So
Everything.
Yeah. So for those who might not know, what's your understanding of vicarious trauma, or compassion fatigue as it's also called? So what would be your definition?
So for me, I would say that you're almost taking on that person's feelings of their situation, to where you're feeling how they're feeling. You're just super empathetic with them, to the point where you're almost changing how your daily life is. And that might mean that you're spending a lot more time with them. Your physical touch may be a little bit more different than you would be with other people, or your emotional availability is a lot different than you would be with other people. So when you start seeing those little changes of how you're interacting with that person, that's kind of when you're like, oh, okay. Especially in our field, that's when you're like, oh, gotta put that barrier up, gotta put that, that safety net up, because it's so easy to get into a situation, and it'd be the naturalest thing ever, because we're human. We want to help people, we want to be there for people, we want to support people, but there's just so much red tape. There's so much red tape and so much issues with it. Can possibly be a lawsuit. Like, I don't know if anybody watches New Amsterdam. That was another reason why I posted what I posted. The show New Amsterdam is like a medical show, like Grey's Anatomy and whatnot. But there's this psychologist, Iggy. He works with children who are like in residential, almost in the hospital itself. And there's a situation where there's this one boy that he just feels so much compassion for. He really wants him to succeed, to where he does extra sessions with him, and he's really compassionate towards him. So like, physical touch might be a little bit easier with him. Like, he'll touch him on the shoulder, he'll touch him on his face or whatever. And then for us, it might be like, oh, okay, he's just, trying to help him out, trying to make him feel comfortable, whatever. And I felt myself justifying it. Like, oh, he's just being there for him. And then the DCS worker saw it, and she was like, oh gosh, I got to file a report. And so that made this big old hoopla about it. So I was just like, and that was another thing that I was like, ooh, I got to think about, how am I treating these girls? I had to step back and look at what's going on.
Even more so when you get involved with children. I mean, with anybody, but especially like children, there's that so much more caution that you have to, and I'm sure that's hard, because especially teenage girls, they can be very affectionate, very, they want to be leaning on you and all of that. So I'm sure that line it's such a hard line to toe.
Oh, definitely. Especially at my center, they've gotten very used to physical touch there, but it's a good, they know the good. It's a good physical touch. And I feel weird because I'm so like not standoffish. I never tell them no or push them away, but I do a lot of side hugs. They want to come from the front. I'm like, okay, no, let's do side hugs and pat
Right.
pats. Like, that's okay.
Yeah.
And I see a lot of the staff do like frontal hugs and, you know, real close and intimate. I'm just like, that could be an issue if a parent sees that, or if
Yeah.
another worker sees that, or, you know, anybody that might be a little bit uncomfortable with that sees that. It's an easy report. You know what I mean? So I do plan on having almost like a seminar of sorts for the workers with not necessarily good touch, bad touch, but just touch for workers,
Yeah.
how to be compassionate in our job and not push them away because they've had a history of bad touch,
Right.
whether that be, you know, physical or whatnot, but just how to protect ourselves and still be
Yeah.
ourselves.
That's a good point. Kind of going back a little bit. So a lot of people, sometimes they hear compassion fatigue and they immediately think that that's like burnout. And so they think that like, oh, you're just getting too overwhelmed. So for you, like, how would you help people to be able to differentiate between this is compassion fatigue, this is vicarious trauma versus this is burnout?
So for me, compassion fatigue is again me just doing extra stuff to make somebody else feel good, and it being more of an emotional tax on myself. Burnout for me is more so the physical manifestation of me being tired, the long days, the amount of notes I'm doing daily, just like a growing nagging of my responsibilities and things I need to do day in and day out. That's more so, and the feeling of it never ending.
Yeah.
That's burnout to me, and it just being like, okay, I'm done.
Right.
I can't, like, and it's, you know, it's a mental thing. And on the other flip side, it's more of the emotional taxing. Like, I feel like I can't come home and I need to decompress and I'm crying, or I can watch a dog commercial and I'm just like in tears because I've, you know, watched so much mess
Right.
or heard so much, like, in these little girls, like 12, 13, 14. And I'm just like, my God, like when I was 13 and 14, I was playing basketball, or, you know, I was being a kid, and these girls didn't have that chance to be a kid. And then you're just constantly thinking and thinking and thinking. And then it's like, you're sad. It just messes up with your whole day.
Yeah, absolutely. So I wanted to give just I like to give my facts. So two of the main places that I found some information from, one was like the Headington Institute, and another one, there's actually a Vicarious Trauma Institute. And so they differentiated, saying, you know, vicarious trauma, it happens because you care about other people who have been hurt and feel committed or responsible to help them. And over time, this process can lead to changes in your psychological, physical, and spiritual well-being. It's a process that unfolds over time, and it's definitely something that happens because you care, because you empathize with people who are hurting, and you feel that commitment, you feel that responsibility to say, you know, like you mentioned, working those long hours, staying later just to be there, and then it almost feels like this responsibility rather than, you know, to go above and beyond. So what are some of the signs and symptoms that you kind of mentioned a little bit earlier, just like staying later and feeling like you were taking on a lot? But what, I guess, would be triggers that people might want to look out for? And again, this is something that can affect not just social workers, but doctors will see this, nurses, even teachers. I'm sure anybody, I feel like, who's in like that helping profession or consistently working with people, especially those populations who are more sensitive to trauma, can deal with this.
Yeah. I feel, and I've saw a lot of the people that have dealt with vicarious trauma have had their own trauma backgrounds. Something that may be similar or just same as somebody else. And that's kind of what I'm going through, is that I have a similar background as these girls. So it's easier for me to relate, but it's also harder for me to almost dissociate myself from it and not place myself in the trauma. So that's what I was struggling with in my first few weeks at the residential center, is that I was like, I'm in there like, oh yes, I remember that, or I remember that feeling, or I remember feeling that guilt and shame, and, you know, having to go to school and people know what happened and things like that. So yeah.
Yeah. And I think, and it's such a interesting line, I guess, for me too, because when I think about some of the things that trigger me are some of the things I feel like that help me be able to help that person the most. You know, like I'm
Oh yeah.
working with a person right now who's in the process of dealing with like some really severe issues in her marriage, and I relate to her so much because I'm like, man, I remember going through that before I went through my divorce, and I remember feeling this, and I remember the isolation, and so like I'm in it with her, and I feel like it helps me to really relate to her, and it helps me to really like know how to, you know, be there for her. But then it's also like, okay, where do I draw the line too, to be able to say, okay, I can't be worried about her when I go home, and then thinking like, okay, well, what's she doing this weekend? Is she taking care of herself? You know, all of that, like being able to say, okay, the setting up those boundaries.
Right. And I think the thing that is helping me right now is like, if I can't put it in my notes and I can't justify the time that I'm spending with them, don't do it. Like I've made it super simple. If I can't put it in my notes and I can't let it be read in front of the judge or probation or whomever, I don't need to be doing it.
That's good. Yeah, Carol says a self-care plan. That's good, and that's so good. I was actually going to go to some of my next points just about like coping with it, because I feel like being in a profession where you're helping people or you're exposed to people who are dealing with trauma, it's gonna happen. It might be inevitable, you know. So what can we do to make sure that we're taking care of ourselves? One of the things I found, people said that it was like escape, rest, and play, and then transforming the vicarious trauma. So making it mean something, nurturing a sense of meaning and hope, what gives life and work meaning, and what instills or renews hope. So focusing on that. So for you, what are some things that kind of help you to, and you mentioned being able to say, okay, setting boundaries, I'm only going to stay, I'm only going to, you know, not do anything that I can't put in my notes.
So as far as a self-care plan for myself, is that what you're asking?
Yeah.
So with everything I do have going on, I'm in 2 different school programs and then working and trying to have some type of social life. For me, I try to make it a point that on the weekends, if I don't have anything I can't reschedule, I try to hang out with my family, or I try to hang out with some friends, or just sleep. Sleep is my biggest issue. I have insomnia really bad, so I try to sleep. Because there's points in my life where I can see that I wasn't sleeping, I wasn't eating the best, and I was isolating myself almost. And I was justifying it because I was busy. I had school, I had homework, I had my PhD stuff, I had to travel out of town for school. But I had to make it a point that I had to just be grounded and find, like, watch Hulu, like as simple as watching a show on Hulu and just taking time for myself. And then a majority of my friends are in the field as well, so like I talk to them. I talk to them like Carol. I talk to Carol a lot. And then like Lanisha. I mean, there's different people that I talk to a lot about what's going on at different periods of time in my life. Because I feel like I'm always trying to be the strong one. You know, you see those memes around like the strong one, blah, blah, blah. But it's true. It's like we try to be that strong one because we're in the field, right? We're supposed to be able to handle our own mess and have this picture perfect life because we're therapists, or we're mental, or, you know, we work in the field. But we need people too. We're just as human as anybody else. We need to talk about what's going on.
Absolutely. Carol also commented talking about having your own therapist, and that's so good. And I have a lot of friends, I'm in the same boat, where they're in similar fields. And so I told them, I was like, I need a support group, because even just transitioning into private practice, I realized not having those sounding boards that you often will get like with supervision, or, you know, even just like staff meetings. I'm like, I don't have anywhere to process some of this stuff. Like, I'm just going home with it. And I'm like, I can't really talk to my husband about it because, you know, HIPAA, but also like, he's not even a therapist.
He doesn't understand.
Some of the stuff, like, he doesn't know like what, you know, things that I could say or interventions I could use, or, you know, things like that, or just like how to deal with, like, I just had to listen to someone talk for an hour about how miserable they were. And then I'm like, and how do I take that? Because the human part of me, like, wants to reach across the room and hug them and cry with them. And like, you know, and I'm like, how do I bottle that up to say, okay, I need to be, you know, it takes a lot to like not break down, you know, in my own sessions sometimes to be like, okay, hey,
Yeah.
like, I really, really want to, like, feel this with you, but I have to have that, so, but I'm like, I have to process it somewhere. So that's been big for me, is like finding people, other professionals that I can like bounce ideas off of, or just even like say, hey, I had a really difficult session. I feel like I just completely failed. Like, I need to talk about this, and being able to have that. And then, like you said, the simple stuff, making sure I'm eating, making sure I'm getting enough sleep, making sure I'm eating good food,
Yep.
making sure that I'm taking that time to like, not think about, stuff, because it sounds really simple, but when you get really busy, it's not, and then you realize you're not prioritizing
Yep.
yourself at all.
Right. And it's easy to not, because we're helpers. We're naturally wanting to help somebody, everybody. And it's like, even when we come home, we have responsibilities at home. We want to talk to our significant others and hear about their day. And then we just get caught up in how can we help them. But we need, and there's just sometimes where I'm just like, I just need to talk, and I don't want you to say anything. Just let me talk.
Yeah.
You don't have to have a solution. Just listen to me.
Yeah. Kayla said, I haven't had a meeting, and I don't know how long. We gotta be intentional about it. And that's something, and it's so funny because we teach this to our clients, right? We're constantly telling them, like, you need to take care of yourself, and you need to find me time, and you need to do that. But then, I'll be the first one to be like, oh, well, I just don't have time for it. Or, like, I need to, I'm going to get to it, but I have to do this first. I have to do this first, especially, because we're millennials. And if you're like me, I have like 5 different jobs. So it's like, I have this, and then I have this, and then I have this. And, like you said, on top of a social life. So it's like not really thinking about like, oh, like but if I don't, then I tell my husband all the time, like, you can't pour from an empty vessel. So if I'm constantly like just pouring and pouring and pouring, but I'm not doing anything to refill myself, like, I'm not going to be good for anybody, and then that's when it's going to lead to that burnout.
You're so right. That's exactly it. And we keep trying to like get the drips out of the cup.
Yeah.
We're like, okay, this is one where we can do it on fumes.
I got a little bit more.
I can do it. And it's okay not to be okay. And it's okay to just ask for help. And one thing that I loved about working at my previous job was that asking for help wasn't like a shame thing. Like, it wasn't wrong for me to be like, I can't do this. Can somebody cover this for me? And it was the times where I just needed a break. I just needed to sit at home and not do anything, or clean, or do something that just wasn't client related.
Absolutely.
So that's one thing. And even at my job now, it's easy for me to be like, okay, I can't be here on Saturdays. Okay, cool. We'll take over your groups. Oh, is that easy?
Right.
Okay. Cool. Thanks.
Yeah. And that's another, and I think that also is another layer too, because I look at also like how we've been socialized. So even if we think about like just the Black woman and how she's socialized to like carry all of these burdens and feeling like if I need help, then now I'm becoming a burden to somebody else. That's just something I feel like I've like realized and experienced. Like, what are your thoughts on that?
Oh yeah, I feel the same way, because even just looking at my family history, just the women in my family, it's like they were mothers, they were wives, they were entrepreneurs. There weren't many people in my life that didn't have their own thing going on. And I'm supposed to have that same standard for myself, right? Like, I can't be the one to fail the family. And there's a whole bunch of pressure to put on myself, unnecessary pressure, because my mom will tell you right now, even if I was flipping burgers at Burger King, which is fine, she's proud of me. I can be the most accomplished person doing a little bit of something, but I'm putting unnecessary pressure on myself for no reason. So I have to just think about the things that I'm doing and just be proud of that, and just work on the things that I can do, and not overstretch myself trying to fit a standard that I didn't create.
Yes. Amen. Absolutely. Like, it's that unnecessary pressure. And I feel like I get it on so many levels, because I'm like a very type A personality, but then I'm the oldest child, the firstborn, so all of that like birth order stuff too. And I'll just be like, I have to perform and I have to succeed. And then sometimes I have to be like, girl, no, you don't. Like, it's okay to not be there. And it's okay to not be strong. I bought my sister this book that says it's okay to not be okay. And I promise I feel like everybody should get that. I need to get it for myself because it's like, it's so true. And it's okay to like not to need that, you know, especially as helpers, because it's like, you know, yes, we have all the training. Yes, we do all this, but it's like, we're still people and we still need, you know, others to help shoulder our burdens too.
Like I literally, what was it? I think it was their Saturday before Mother's Day. I literally just sat in my mom's lap. The best thing ever. I'm 27 years old. I sat in my mom's lap and it was the best thing ever. I loved being vulnerable for the first time. And I would say since being 18, I've actually just let myself relax. And I was in her lap for, I think, maybe 30 minutes. And I was just like, am I too heavy? Am I too heavy? She's like, no, I just love you being right here. And I just loved that time with her and just being almost like childlike, almost like giving myself that chance to just let the PhD fall down, let the master fall down, let the bachelor's fall down, let being over 18 fall down, and just let my guard down. And with the person I feel the most safe with was my mom, and just being in her arms.
That's beautiful. And I'm so glad that you have that safe space to go to, because a lot of people don't. So, you know, I'm happy that you had that. I have a few like reflection questions that I found were pretty good. So what are some ways that you have changed over time because of your work?
Oh, wow. So there's positive and negatives. Positive, I would say the number one way is that I found a way to channel what I've been through into a way that I can help people who've been through what I've been through. And not necessarily in like a hero mechanism. I forgot what it's called. The hero complex. Not even like that, but it's just more so like I didn't want anybody to feel the way I felt without having somebody to feel it with.
Oh, that's powerful.
If that makes sense.
I love that.
Yeah. 'Cause I felt so alone in my town, and where I grew up was primarily Caucasian. So there was really wasn't anybody that looked like me. There wasn't really anybody that understood what I was going through. I didn't have anybody that was trained in trauma. And I was court ordered. So it's like when you get court ordered to do something, you're like, I don't want to be here. And I literally just sat in the office. I'm like, I'm not talking. I know you're billing I'm here, but I'm not talking to you. But yeah, just that. And then another positive was that it gave me more of the educational background to kind of understand trauma in the brain and like the psychology behind it. I'm such a nerd when it comes to psychology. Like I love the brain, like the mechanisms and how it works, why it works that way, how everybody processes trauma differently. And then I would say the negative for me is just constantly having to check myself when it comes to my own trauma and my own triggers. I remember coming out of my bachelor's degree in 2014, my first job was DCS. And the first unit I was put into was a sexual abuse unit. How it happened, I have no idea. Like, it wasn't like I was seeking it. I'd never said anything about my trauma. I never said anything about kind of what the trajectory I wanted for my career was to be. It just happened that way. And the first case I had was a 3-year-old. When I tell you I went through the worst emotional like battlefield ever, to the point where I had to quit because I was in and out the hospital because I was getting so sick. My body was just like, I was so stressed. My body was taking it out on me. Because I hadn't handled my own trauma at that point. So I had to get back into therapy. I was in therapy for 2 years until I felt comfortable taking on cases that dealt with sexual trauma.
That's so good. Would you suggest that most therapists go through therapy specific to like their triggers and their trauma, or like, do you feel like there's certain parts in your career where it's best to do it, or should it be multiple points?
I feel like anybody, but therapists and mental health workers in the same, should be in therapy just to be in therapy, not just to deal with the trauma, because there's different, modalities that you can use, like mindfulness and whatnot, to kind of figure out what your triggers are on your own. But it's always nice to talk to somebody that doesn't know you. Or, I mean, there might be people that know a little bit about you, but don't know you in that personal way. Um, I think in grad school especially, it should be a requirement to have a therapist.
Yeah.
That's what I think. With any school program, it should be required to have a therapist while you're going through this, because depending on what you're concentrating in, you're going to see some
Yeah.
stuff, and you have to have a way to process it. And a lot of our super, well, a lot of my supervisors were too busy. They had like the hour that they're supposed to
Right.
do, but if I needed more than an hour, I'm kind of shit out of luck.
Yeah.
You know what I mean? Like, now I got to process this on my
Yeah.
own.
I completely agree. And
Mm-hmm.
I'm thinking back to like when I was in grad school. And so my concentration in grad school was holistic social work. So very like mindfulness based things, alternative medicine and things like that. But that's when I started dealing with generalized anxiety disorder. The way that life works, I was in the middle of going through a separation and a divorce, and then I got generalized anxiety disorder, and I was having panic attacks every night when I was driving home from school. So it was like, but in my mind, it never clicked like, hey, maybe you should be in therapy too, or or even that, so I totally agree with that like, yes, especially
Mm-hmm.
in grad school, but anybody, like I said, anybody, but especially those in the helping professions, like, because it is, and it's good to have those checkpoints, and then it's especially, you can't always be as vulnerable with your colleagues as you want, or even, other, because
Yeah.
of course, there's that whole imposter syndrome, I feel like, that comes up too, because when you get to a certain point in your career, you also
Mm-hmm.
feel like, oh, I should have dealt with this by now, or I should be doing this, or I should be
Yeah.
good, or like, I'm in my PhD, or I'm doing this, and it's just kind of like, but no, sometimes I'm just me, and sometimes, I just need somebody
Yeah.
to hear me. So yeah, that's good. You kind of answer this. What are some ways that caring about people who have been hurt affects you?
I think it goes back to almost the triggers. I would say for me personally, it goes back to my triggers. But it also feels like, how am I helping them enough? Am I doing enough to help them? Especially when I only have essentially, well, in my center it's 3 to 6 months with the girls, but am I doing enough so that they don't relapse, or that they don't go back to unsafe homes, or am I using the right modality for them, or the right therapy for them, or whatever? That's like the constant worry.
Yeah. I feel like that
Mm-hmm.
too, for sure. Like, where it's constantly like, you kind of have your ideas of things that you like know, but then you're
Yeah.
also worrying, like, is this right for them? And is this going to be most effective?
Mm-hmm.
That's interesting. And it's so funny. I've actually been getting way more adolescents lately. Like, I have about 4 13 through 16-year-olds on my caseload right now, and I'm just like,
They're fun.
if anybody who knows me knows that I always say children are not my ministry. So I'm just like, I don't know what to do. Like, with kids, I'm like, adults, I got, but I know. So we might have to talk anyway, because I'm like, okay, I need to
I
know how
got
to deal
you.
with this. What is your opinion of the statement that pain is inevitable, but suffering is optional? Do you see this as relevant to your experiences of vicarious trauma?
Not in regards to vicarious trauma, no. Because it happens so sneakily. Is that a word? But it just sneaks up on you. Like, you don't realize what's happening until you're in like the end of it, and it's just kicking your
Yeah.
butt. Because you justify it with human emotion. Like, well, I care about them. I want them to succeed. I want them to have this happy, childhood or happy adult life. Um, and you don't realize almost that you're creating a dependency for them on you, and you're taking on their burden, not their burden, but their
Mm-hmm.
trauma. And you have no way of letting it go, because now you're stuck with it, because you're afraid of HIPAA, and you can't say, everything that they're going through, because who knows who.
Right.
You know what I mean? So I won't say that I would say pain is inevitable. It's just gonna happen. Everybody goes through something painful, and everybody handles pain differently. Um, but suffering, when it comes to vicarious trauma, there's always resources out
Yeah.
there. I mean, there's people on the internet that will talk to you like us.
Yeah.
If there's something going on, I always make myself available to anybody if they want to talk. Like, I don't care if I don't know you from a box of sticks. Like, if you call me and you're like, hey, I need help, I'm going to see what I can do for you, whether it be over the internet or we can meet
Yeah.
up or whatever the case may be. Um, So I think with vicarious trauma, like just reaching out and it's not being so scared to say I need help.
Absolutely. Oh, this is a good one because this is something I always think about too, because it can be really hard. How do you measure success in your work?
For me, I think at this point I'm a professional student. I don't know how not to be in school. But success for me is when I feel good at the end of the day that whatever I did in that day was enough. And it took me a minute to get there because I felt like I needed that treatment goal to be completed, or I can write it off, or that family to be reunited, DCS wise,
Right.
or something like that. Like I was so focused on the almost materialistic point of my treatments. But I had to see like it was me. I needed to feel good about what I was doing. Like that was success for me. Um, and now I'm just like, okay, cool. Like, yes, I got the degrees. It doesn't mean anything. Like, it means something, but it doesn't mean anything to me in the point where I'm like, oh, yeah, I'm successful. I'm just making all this, whatever. I don't care about that. It just helps me along the way when it comes to who I'm helping. But yeah, so for me, success is really just me being happy.
Yeah. That's good. And seeing to add on to that, I think for me is like seeing that my client is growing or that they're like evolving, and I feeling like I'm making a difference. And that I'm able to, I'm in a unique position now where I'm working with a Christian counseling agency. So like for me, a big part of it has been like, can I show the love of God, And so if I have a client that's telling me like, man, like I literally had someone tell me the other day, like, when I first started, I was nervous, especially because I'm usually younger than the majority of my clients, and they're like, she was like, I was talking to my sister and she was just telling me, just make sure I just see God in you, and don't worry about, she didn't say it, but I felt like it was like, don't worry about age, don't worry about all that. And it's just like being able to say, okay, if they can feel God's love in this session, like I've done my job, and that's it.
Right. Yeah. And that's a big thing too, is and I found that mostly with this job specifically is that these girls, and well, period, because people come and go when it comes to therapists. Like turnover is high everywhere you go.
Right.
And just hearing like some of like my little bitty ones, like when I was working at the elementary school, it's trying to say like advocacy because they hear me say it all the time. And it's like, and I wasn't trying to teach them what the word advocacy, but just the principle of it. And, just speaking up, saying that you needed this or you needed that. And, them using different words that I used and just kind of seeing that imprint that I left on them was really powerful for me because it validated that everything I'm going through day in and day out is worth it.
Yeah. So good. That was all the questions I have. Do you have any like final comments or like takeaways that you wanted to share? Anything you want to share specific to like your work or things that you want people to know?
Honestly, I mean, anybody, like I said earlier, if there's anything you guys need to talk about, if you need help with something, or if you have questions, reach out. You can add me. Just let me know that you came from this live video, so I'm not like, who is this person? But I'm available. I'm available via phone, email, Facebook, in person. But if I can be that person that can help you, I'm there.
Yeah. And what area are you in, just in case there are people who are watching that maybe they're not in Chicago? So I'm based in Chicago and you're based in
Indianapolis.
Okay. See, we going across states now, y'all. So we gonna by the end of the year it's gonna be worldwide. I'm gonna try to find some people from like all different regions and stuff.
Yeah.
In Jesus' name.
Yeah, definitely.
But thank you so much for being on here. Thank you for making yourself available. Like I said, we're going to bring you back because we want to talk about sex and healthy sex and all of that good stuff. And I'm sure we're going to have a whole bunch of questions in that one. We're going to hype people up for that. But thank you just for sharing your experiences and your expertise and making that status and making it relevant because it's so important and we need to talk about these things.